River Navarro. I'm the Director of Clinical Services here at Bakersfield Behavioral Healthcare Hospital. I'd like to say hello to all of our Facebook family and friends. It's been a minute. I took a couple weeks off recording, but I'm back. I'm excited to be here. I'd like to wish everyone a happy Wellness Wednesday. Happy Wellness Wednesday to all. Today, I'd like to talk about reactions to stress during COVID-19. So I know I talk about COVID-19 quite a bit, but I think it's really important. We're having some changes here locally, here in Kern County. We're looking at going into the next tier, with restaurants opening for indoor dining. I think nail salons are open already. Schools are looking at becoming reintegrated. So here at BBHH, it's business as usual, but for a lot of businesses, things are changing, and we're kind of getting back to this normal / new normal that we talk about here. So normal, but kind of in a different way, with social distancing protocols, masking, so on and so forth, like we've been doing here at the hospital. But I really want to talk about this today, separately from all of that, because I want to normalize a lot of things at this time. So the pandemic has definitely, I think, gone on much longer than a lot of us anticipated, and that can be a source of stress for a lot of people even now. So I know I always refer back to this new normal and kind of the new ways that we're doing things, but things are going to be different for a long time. So we haven't had a pandemic like this in about a century. So none of us have really had this during our lifetimes, and so we've had to make a lot of adjustments. It's been really hard on a lot of people. So I really want to normalize that for those of you who are struggling to cope or struggling to accept, kind of what's going on, and the fact that this doesn't seem to be going away anytime soon. So I want to take that moment. If you're feeling that way, I know I'm still feeling anxious. It's hard not being able to, see family and friends. I am choosing to social distance, and to keep people safe. So however you're living and whatever adjustments you've made, it's definitely been tough. I've had to get creative with how I stay connected to people, and I hope all of you are doing the same. So I want to start out by saying that everyone reacts differently to stressful situations. Okay, there's no right or wrong to that. And regardless of who you are, you may be having a different reaction, and that's okay. There's not a rhyme. It doesn't have to be a rhyme or reason to that. So I want to start out by saying that whatever your reaction is fine. And how you react to stressful situations can depend on a lot of different factors. So I want to go through some of those things too, and kind of walk you through some maybe different experiences you've had, or different factors in your life that may make a difference with how you react to stressful situations in general, but specifically the pandemic as being one of those stressful situations. So these are some things that may impact your reaction to things. That can depend on different things in your background, like how you grew up, how other people around you reacted to stress while you were growing up. That might be an example of something. What messages you got about how to manage stress growing up, that's important. How much social support you have. So social support's a pretty big deal, especially with so many people social distancing. Being able to maintain healthy relationships and support systems has been a pretty big deal. Your financial situation can definitely impact how you're reacting to the pandemic and the different challenges we've been facing. I know many people have been out of work or had their hours cut. Some people may or may not have health insurance as a result, not sure how they're going to support themselves and their families. People have had to make some really difficult decisions, and so your financial situation can definitely impact how you're reacting at this time. Your health and also your emotional background, right? So we kind of talked about your background kind of growing up, but also what is your current mental and emotional status like. That can make a difference in a lot of things in how you react to stress and how equipped you'll be to react to stress. The community you live in makes a difference, right? So the groups you're part of, whether you are part of any local communities or not, whether you're still able to partake in activities from those communities can make a big deal. That kind of goes back to social support a little bit. So those are just some examples of different factors that may play into your ability to manage stress and then how you react when these stressful things happen, right? And all of that is perfectly okay. So I'm going to kind of go through a list of different types of people as well that also may have trouble managing stress in the middle of a crisis, a pandemic, a situation, however you want to think of that. Children and teens may be having a hard time with so many kids being out of school and being out of kind of their normal routine, being able to spend time with their peers. Having all of those social interactions, makes a difference. So having to, learn online, virtual at home, that's a really big adjustment. So if you're a parent and you have a child or teen in your home, I salute you. I can only imagine what that feels like. So definitely kids and teens are having a reaction, and it's really important to talk to them about that and to acknowledge that what they're feeling is normal, right? People caring for family members, like caretakers. So if you have maybe a parent in your home you're taking care of, or another family member, or something like that, that can definitely make you more vulnerable. Maybe you're already experiencing some kind of stress, and then you just throw a pandemic right on top of it. So just things to consider. First responders. So that's definitely, that's a thing. So here at BBHH, we are first responders. We never closed our doors during the pandemic. It's been business as usual, like I stated earlier. And our, mental health crises don't go away in a pandemic. So I say that because many of, our own staff members have been impacted. The medical community has been impacted. People working at stores, all these different first responders have been, struggling to cope, right? And then they have their own personal situations going on at home, and then it's like they're getting kind of hit from all sides, I guess you could say. So those are some things to keep in mind. I'll mention kind of a couple other groups. I'm not going to go through, my whole long list here, but just some things to consider. Anyone who has a mental health disorder and or substance use disorder. So for people who were, going to 12-step meetings or any kind of groups, some people that were in counseling, or maybe some of their outpatient teams, had to cut staff for a while. It's been very difficult, not just for the medical community to accommodate all of the COVID cases, but it's been very difficult for the mental health and substance use workers to be able to accommodate all of their patients as well. So I'm sure there's delays everywhere. People have had trouble getting in for therapy, for counseling, case management services, medication services, so on and so forth. Just all those industries have really been impacted by the pandemic. And anyone who has any type of other, physical disability, any other disability at all is definitely going to feel it during this time too, for the reasons I mentioned before. So my reason in sharing all this is to, I guess, kind of tap into, empathy, right? So one of the keys to coping with stress during any type of stressful situation is maintaining connections with others. And in some of my previous videos, I've talked quite a bit about empathy and how that's the key to connecting with other people, right? So the more empathy you have for other people, being able to put yourself in their shoes and being able to relate to maybe how they're coping or not coping right now is really important, right? We just want to be able to put it into a context so that we can continue connecting with other people during this time, because social support is so important right now to all of us. So I want to kind of end with some friendly tips. So I want to empower you to do some of these things, since, like I mentioned, this isn't going away for a while, and I want to equip you with some little tricks or tools, things to put in your bag, to save for later. So I want to leave you with something, some type of positive note here. So a lot of these I've kind of, gone over here and there, but I just want to recap some friendly tips for how to cope with stress during the pandemic. So video chatting, right? Because we want to stay in communication with other people. So if you're a person like myself and you are still social distancing, video chatting is nice. Zoom meetings, of course. Texting, I always say text your friends, check on people, say, hey, thinking of you, miss you, love you, all that good stuff. So the key here is just really staying connected and maintaining positive relationships with those special people in your lives. Next friendly tip: learn healthy ways of coping with stress. So I'm going to give you some examples of that. Take care of your body, right? Drink water. Make sure you're eating regular, consistent meals, right? You want to nourish your body. You want to eat well-balanced meals. You want to make sure you're maintaining some type of schedule as best you can, right? We talked about sleep hygiene several weeks ago. Get your sleep in, right? Create some type of sleep routine. Try going to bed and waking up roughly around the same time every day. We talked about establishing bedtime routines, morning routines, things like that, right? So creating routines and really sticking to them will give you some sense of normalcy during all this. Also taking time to unwind and relax, right? You're allowed to do that. So those are all the friendly tips I have for today. I hope that you found this video useful, and I look forward to bringing you some new information next week. Have a great day, everyone. Bye.